The topic is concept of hearing loss. What do we mean by hearing loss? As you know, there are people with normal hearing with the ability to hear different sounds. And on the other hand, there are deaf and hard of hearing people. I will tell you about hearing loss. Let us understand it with the help of an analogy. The average normal body temperature is generally accepted as 98.6 degree Fahrenheit. As the temperature increases beyond that, we state that the person is having fever. When a person's body temperature is dangerously low, the brain and body cannot function properly. So, hearing loss is not a disease or illness, but there are degrees of hearing levels. It is important to distinguish between different levels of hearing loss. There are degrees of hearing levels, which two are indicated using the unit dB, decibels. The unit of measurement for hearing is decibels, short form dB. It is written with small d and capital B. Hearing loss is classified in four ways. First is age of onset. Second, site of lesion. Third, nature of hearing loss. Fourth, degree of hearing loss. We will discuss age of onset. Hearing loss based on it can be classified in the following ways. First is congenital hearing loss. It refers to any hearing loss occurring before birth or at the time of birth. It may be hereditary or may develop during the prenatal or natal period. Second is acquired hearing loss. It can be classified in two ways. Prelingual hearing loss. It refers to that hearing loss that occurs before the child has achieved basic competency in his or her primary language. It comes by birth or occurring before age 3 years due to various reasons like sickness, accident, or injury. And postlingual hearing loss. It refers to that hearing loss that occurs in later childhood or adulthood after the acquisition of language. The reason for hearing loss may be illness, ear infection, accident, injury, old age, etc. Second classification of hearing loss is site of lesion. Our ear is divided into three parts. There are three physical origin of impairment. First is sensory neural hearing loss. Sensory neural hearing loss occurs when there is a problem with the sensory, that is hair cells, and or auditory nerves in the inner ear's cochlea. Second is conductive hearing loss. It is mechanical in nature, that is, there is damage to the eardrum or auditory bones. In normal hearing, the eardrum vibrates and the auditory bones vibrate to carry the sound into the inner ear. Conductive hearing loss occurs when sound waves cannot reach the inner ear. The cause may be earwax buildup, fluid, or a punctured eardrum. Third is mixed hearing loss. A mixed hearing loss means there is sensory neural hearing loss along with the conductive hearing loss component. Third classification is nature of hearing loss. It is divided into two types: gradual hearing loss and sudden hearing loss. Age related hearing loss is the gradual loss of hearing in both ears. It's a common problem linked to aging. It may also be caused by regular exposure to loud noises. at workplaces like drilling or hammering. Sudden hearing loss is a rapid loss of hearing. It can happen due to a person getting into an accident, severe illness that may cause deafness, or combat injury to the ear. These were the classification based on nature of hearing loss. Fourth classification is the degree of hearing loss. Did you see the picture? The levels of hearing loss are generally classified as per the severity of the hearing loss that the individual experiences. People who can hear well and don't have difficulty in listening, they have normal hearing sensitivity. Hard of hearing people and people who only respond to loud pitch noises and face problems hearing in most situations have moderately severe hearing loss. A person with a profound hearing loss probably would not hear any speech and face difficulty in recognizing sounds. Each hearing sensitivity and loss ranges between certain decibels. According to the Rights of Person with Disability Act 2016, deaf means person having 70 dB hearing loss in speech frequencies in both ears. Hard of hearing means a person having 60 dB to 70 dB hearing loss in speech frequencies in both ears. In conclusion, having hearing loss does not mean that life will be a failure. There are many reasons for its cause and varying degrees. A child who is born deaf hasn't really experienced the loss of hearing that might have happened due to prenatal complication. Some people can experience loss of hearing after getting into an accident or ear related injury. And not all deaf people have same level of hearing loss. Some are able to hear loud sounds but not comprehend what is being said. Some may benefit from using hearing aids to amplify sound and understand speech for communication. And some have profound hearing loss which do not hear anything and often rely on sign language.